Cataract surgery had changed millions of lives, giving patients back their clear vision and confidence. But here is what most patients don't realize. The success of your cataract surgery doesn't only depend on operation. It depends a lot on many decisions that you make before and after your cataract surgery. I'm Dr. Vardhman from Asian Eye Hospital, and I'm going to take you through the 5 biggest mistakes that the patients make before, during, or after their cataract operations, and also some tips on how to avoid them and how to get the best possible outcomes. The first mistake is choosing the hospital only by the cost. Most patients make this mistake by choosing the hospital or the surgeon based only on the price. You have to understand that your eyes are priceless, and 80% of our knowledge that we get around the world is only through our vision from our eyes. Therefore, cataract surgery is not just a medical procedure, but it is much beyond. It is an investment in your vision, in your independence, and the quality of life for decades to come. Your surgeon's expertise, the technology used, and the quality of lenses can make a huge difference in the results and the safety of your cataract surgery. So ensure that you choose a center where the surgeon's expertise is par excellence, the technology used is cutting edge, and who invests in your safety when they are doing their surgery. The mistake number 2 is not understanding your lens options. One of the most important decisions you have to make during cataract surgery is to choose the best suited intraocular lens during your cataract surgery. So as patients, don't just go through the cataract surgeries without understanding that there are advanced lens options such as toric IOLs, which can treat your pre-existing astigmatism, the EDOF lenses, which are also known as the extended depth of focus lenses, which can give you a clear vision at variety of distance without much nighttime optical phenomenons, and the current generation of trifocal lenses, which can possibly near about eliminate your need for glasses for day-to-day life. So your lens choice should depend on your lifestyle, your work needs, and your vision goals. Discuss all the possible options with your cataract surgeon before choosing the best suited lens for you. The third mistake is to ignore the pre-surgery eye health. Most patients make the mistake of not understanding that the final outcome of your cataract surgery will get affected if you already have pre-existing dry eye, glaucoma, retinal disorders, or corneal weakness. Therefore, you should always choose a center which does a very comprehensive pre-cataract evaluation, which will ensure that you do not suffer from any other eye elements apart from having cataracts. And the fourth mistake is very common, is that most patients believe the cataract surgery will fix all eye problems forever. Most patients believe the cataract surgery is a fix-all procedure, and they think that once it is done, that will solve all their problems of the eyes forever. However, that is not absolutely true, because the cataract surgery only replaces your cloudy internal lens of the eye and then replaces it with a clear intraocular lens during the cataract surgery. But the rest of your eye ages with your body. Because of continued aging effects on your eyes, the eyes can develop other age-related disorders in time, such as dryness, macular degeneration, glaucoma, corneal issues, so on and so forth. Therefore, it is very important not to miss your annual eye checkups even after undergoing a very successful cataract procedure. And the fifth mistake is delaying your surgery for too long. Some patients wait till the time their vision becomes extremely poor before deciding for surgery. But waiting too long can make your cataracts very hard to remove. That can make cataract surgery riskier and more complicated. Please understand that modern cataract surgery is done through tiny 2 mm incisions. It is completely painless, without the need of any injections, without the need of any stitches, and a very quick recovery. But that's only possible if you undergo cataract surgery in the right stage of your cataracts. So avoiding these 5 mistakes can ensure better safety, smoother recovery, and much better quality of vision and quality of life for long run. So if you found this video useful, do like, share and subscribe our Asian Eye Hospital channel for such more educational videos for the future. This is Dr. Vardhman signing off. Thank you very much.